Bismillahirrahmanirrahim. A quote of the day is change your thoughts and you change your world. Today, the topic of my presentation is snake bite, and I am presenting it under the supervision of my professor, Dr. Saira Afzal. Learning outlines of the presentation are introduction of snake bite, types of snakes, mechanism of venom action, antivenom, preventive measures for snake bite, treatments of venom, and recent updates. At the end of this presentation, participants will be able to describe about the snake bite, types of snake bite venoms and its prevention along with the treatment. Now, introduction of snake bite. Snake bite bites either to capture prey or for self-defense. But since there are so many different types of snakes, including both venomous and non-venomous, not every snake bite is created equal. Snake bites should always be taken seriously, though some are dry bites which are not as dangerous as wet, likely cause some swelling. Others are venomous bites, which, if not treated carefully and quickly, can result in death. Now, what is epidemiology? Snake bites are not terribly common in the world and they are not usually fatal. But according to the World Health Organization, between 4.5 and 5.4 million snakes bites occur each year, and 1.8 to 2.7 million of those cause illnesses. It is estimated that at least 81,000 to 138,000 people die each year from snake bites. Even so, it is best to treat all snake bites as medical emergency unless one is certain the bite came from non-venomous snake. Different species carry different types of venom. The major categories include cytotoxin, hemorrhagics, anti-clotting agents, neurotoxins, myotoxins, and others. Now, what are cytotoxins? These are the venoms that can cause swelling and tissue damage wherever you have been bitten by that snake. And hemorrhaging are that disrupt the blood vessel. Anti-clotting agents are those that prevent the blood from clotting. Neurotoxins cause paralysis or other damage to the nervous system. Myotoxins can cause breakdown of the muscles. Is every snake bite dangerous? There are two different types of snake bite, and one is more serious than the other. One is dry bite, other is the venomous bite, or this is also known as wet bite. Dry bite. These occur when a snake does not release any venom with its bite. As you would expect, these are really mostly seen with non-venomous snakes. In venomous bites, these are much more dangerous, and they occur when a snake transmits a venom during a bite. Now, there are a few names for non-poisonous snakes. These are green snakes, racer snake, gopher snakes, hognose snakes, red snakes, indigo snake, king snakes, bayonne snakes, and python. All these are the types and names of different non-poisonous type of snakes. Now, poisonous snakes. Poisonous snakes voluntarily emit venom when they bite. They can control the amount of venom they discharge, and 50 to 70% of the venomous snake bite results in envenomic or poisoning. Even with the less serious type of injury, every snake bite should be treated as a medical emergency unless you are absolutely sure that the bite came from a non-venomous snake. Any delay in the treatment can result in serious injury or death. Now, which snakes are venomous? There are two major groups of venomous snakes other than many. First is elapids, that is cobra family. There are about 300 venomous species of Elapidae species. This include kraits, mambas, coral snakes, and sea snakes. They have short fangs in front of the upper jaw and strike downward, followed by chewing. Their venom is mainly neurotoxic, but it can also harm body tissues or blood cells. If a cobra bites you, you can die from paralysis of the heart and lungs very quickly after the bite. King cobra belongs to the longest type of venomous snakes. Other is the vipers. There are more than 200 species of Vipridae, which includes pit vipers like rattlesnakes, copperheads, water moccasins, cottonmouths, and old-world vipers that are adders. They have long, hollow, venomous fangs that are attached to the movable bones in their upper jaw. They fold their fangs back into their mouth when they are not in use. These are the few names of poisonous snakes: Ferdinand's, boom snake, eastern tiger snake, Russell's viper, saw-scaled viper, bandit crate, king cobra. King cobra are the longest venomous snake in the world. Inland taipans. Inland taipans are the deadliest snakes in the world. Risk factors for snake bite. Up to 95% of the snake bites occur either in the tropical or in the developing countries. Those who live in South Asia, South Saharan Desert, Africa are particularly affected by the venomous snake bites, as they often do not have access to adequate healthcare service or antivenom. Snake bites are also especially common in poor communities, often in rural areas. People with specific job are more at risk, and these include agricultural works, herders, fishermen, hunters. In North America, most snakes are not venomous, but those that are venomous include rattlesnake, water moccasins, coral, and copperhead snake. Symptoms of snake bite. Symptoms will differ depending on which type of bite it is. If you suffer from a dry snake bite, you will likely just have swelling and redness around the area of bite. But if you are bitten by a venomous snake, you'll have more widespread symptoms, which include bite marks on the skin, and these can be punctured wounds or smaller, less recognizable marks. A sharp throbbing, burning pain around the bite that you may not feel for a little while after the bite. You may also feel pain all the way up whichever limb was affected, such as in the groin for a bite on the leg or armpit for a bite on the arm. But not everyone feels pain. For example, a bite from coral snake can be almost painless at first, but it is still deadly. Redness, swelling, and tissue damage or complete destruction in the area of the bite happens. Abnormal blood clotting and bleeding. Severe bleeding can lead to a hemorrhage or kidney failure. Low blood pressure, a faster heart rate, and a weaker pulse size. Nausea, vomiting, diarrhea, anxiety, headache, dizziness, and blurred vision. Difficulty breathing, and on severe cases, serious complete loss of breath also happen. Increased production of saliva and sweat, weakness in your mouth, muscle, and numbness in the face or limbs can also be present. Few additional symptoms are difficulty speaking due to extreme tightness in the throat and a swelling tongue. Young children may become very pale. Constant cough or wheezing can happen. Now, what's the mechanism of spread of venom? Once the venom has been injected under the skin or into the muscle, it doesn't go directly into the bloodstream, but it travels around the body through the lymphatic system. Preventive measures. Now, there are few measures for the prevention of snake bite. Depending on where you live or chose to vacation, you may or may not have a hard time avoiding snakes. But if you are going to be in snake territory, there are some useful tips to avoid getting bitten. First is always be careful where you put your hands and feet. Don't reach into unknown spaces and holes or underneath objects without being sure that a snake is not hiding underneath. Uh, don't lie down or sit down in the area where there might be snakes. Wear high top leather boots when walking through or working in areas with dense vegetation. Do not attempt to capture, handle, or keep venomous snakes. If you're going camping, take extra care around swamps and other places where snakes typically live. If you come across a snake, slowly back away from it and avoid touching it. Now, treatment if a snake bite happens. First and foremost, seek medical attention. This means call 911 or emergency services as soon as you can, because if the bite is not that painful initially, you still need to treat it as if it's potentially life threatening. Properly identifying the snake can help with the treatment, though it is very difficult to do so. Now, options for first aid. The steps that are should taken immediately are: first is remove any jewelry or watches, as this could cut into the skin if swelling occurs. Keep the area of the bite below the heart in order to slow the spread of venom through the bloodstream. Remain still and calm if you can. Roll over to your side and rest in the recovery position. Moving around a lot will cause the venom to spread faster through the body. Cover the bite with a clean, dry bandage. Try to use a pressure immobilization bandage if you can. This type of bandage should be tightly wrapped around the wound. Then wrap another bandage around the entire limb so that it is immobilized. While these are all useful precautionary measures, the ultimate treatment for a snake bite is antivenom. Try to get the victim of a bite antivenom as quickly as possible. Now, management of snake bite. Key questions to ask a victim are the body part bitten, how long ago, what sort of snake. Friends and relatives will frequently bring the snake with the patient. It should be handled as little as possible since it may only be injured rather than dead. The amount of venom injected by a bite is highly variable depending on the length of time since the snake last ate and its aggression. Snake venom detection kits are available in some countries. The venom is detected from a dry swab of the bite site using a monoclonal antibody technique. The 20-minute whole blood clotting test is a useful bedside tool in remote areas. A 2 to 3 ml sample of venomous blood from the victim is left undistributed at ambient temperature for at least 20 minutes. The vessel containing the blood is then tipped once and may be compared with the normal control. If it has not been clotted, there is hemostatic disturbances from systemic envenoming. All the patients should have a full blood count, urea, electrolytes, liver function tests, creatinine kinase, troponins, and ECG. Reassuring of the patient is the most important thing. Immobilizing the bitten area to minimize venom spread, identifying the snake, application of firm bandage to occlude lymphatic drainage if appropriate, but tourniquets are not as much helpful since they do not prevent the spread of venom and frequently applied incorrectly. Incision at the bite site and attempts to suck out the venom by mouth should not be made. A large bore IV cannula inserted on an unaffected limb. BP, coagulation, renal, neurological, cardiorespiratory status. These are all should be monitored because hypotension, anaphylactic shock, renal failure, respiratory distress can happen rapidly. All patients with suspected envenoming should be observed for 12 to 24 hours as the initial manifestation may be delayed, especially with elapid bites. Pain vomiting should be managed symptomatically. Aspirin should not be used, it may aggravate bleeding. If severe coagulopathy is there, with thrombocytopenia that is causing DIC, large quantities of fresh frozen plasma, cryoprecipitates, and platelets are required if the response to antivenom is poor. The most appropriate therapy in timely administration of the species appropriate antivenom when indications. Before starting antivenin, ask about the history of allergy. An intradermal sensitivity test is performed by injecting 0.2 ml of the saline diluted antiserum at the site a bit distant from the bite. Uh, the site, the injection site is observed for at least 10 minutes for the redness, hives, pruritus, or other adverse effects. The shorter the interval between injection and reaction, the greater is the degree of sensitivity. Zero point 0.5 ml, like 1 to 1000 ratio adrenaline, must be available when antivenom is given. A negative skin test does not rule out a reaction following administration of the full antivenom dose. The rate antivenom should be based on the severity of the case and the patient's tolerance to the antivenom. The entire initial dose should be given as soon as possible within 4 hours of bite. In severe envenoming, antivenom given up to 24 hours after the bite has been shown to reverse coagulation deficit. Uh, Indications for antivenom administration in snake bite. Cardiogenic shock, spontaneous systemic bleeding, incoagulable blood, neurotoxicity, hematuria, other evidence of hemolysis, rhabdomyolysis, rapidly progressive extensive local swelling, bites on digits by snakes with known necrotic venom. There are three types of any anti-venom reaction. Early anaphylactoid, pyrogenic, and late reaction. If an immediate anaphylactoid reaction occurs, administration of antivenom should be immediately discontinued and the patient should be given an oral antihistamine or intramuscular adrenaline as appropriate. Infusion of the antivenom can be restarted but at a slower rate. Corticosteroids are commonly given to treat serum sickness, although their value remains to be established. Bites by large snake may need relatively high antivenom dose, particularly in children or small adults. Additional antivenom should be administered if the swelling progresses or if systemic features of an envenoming increase in severity and new manifestations such as hypotension or reduced hematocrit appear. The use of ancillary drugs such as anticholinergics for neurotoxic envenoming remains contentious. If pulses are lost in the limb-Batten compartment, syndrome should be suspected and surgical assessment is requested. Wound debridement and later skin grafting are occasionally required, especially in cobras and viper bites, but should never be carried out until the coagulation profile is normal. Awareness and avoidance of the habitat of snakes are the major means of preventing snake bite. Now, what is antivenom? Antivenoms, how are these created? These are created by immunizing horses or sheep with the venom of a particular snake. Their blood serum, that is the watery part of the blood, is then processed as it will contain antibodies that are capable of neutralizing the effects of venom. There are antivenoms that treat bites from specific types of snake, monospecific antivenom, and also those that treat bite from a number of snakes that are found in particular geographic region, that is polyspecific antivenoms. The antivenom will be given either in an injection or through an IV, that is through the needle in the arm, so that it can take action as quickly as possible. Stay in the hospital for at least 24 hours is required by the doctor so that doctors can monitor blood pressure or overall health after the venom administration. If your blood pressure dips below a certain level, you may need IV fluids. If the bite caused a larger than normal loss of blood, blood transfusion may be necessary. Since antivenom has a potential side effect, you'll also need to be monitored. Because of this fact, only trained medical professionals are required for antivenom to give them to patients. The amount of time it takes to completely recover depends on the kind of snake bite, and in most cases, children recover from a bite from an adder in 1 to 2 weeks. Most adults takes more than 3 weeks, but 25% of the patients need anywhere from 1 to 9 months. Pain and swellings are common long-lasting effects in the area of the body where bite occurred. Now, there are few steps that a person should not take while treating a snake bite or preventing it. A snake bite can cause people to panic and act irrationally. This should not happen. Even so, there are certain things you should avoid doing immediately following a snake bite. First is do not panic of the snake or try to wrap it up or kill it, as this will increase your chances of getting bitten again. Even dead snakes can bite. Do not apply a tourniquet. Uh, don't cut in the wound at all. Do not try to suck out the venom. Don't apply ice or used water to submerge the wound. Don't drink alcohol. Don't drink beverages with caffeine. Don't take any pain relieving medication such as brufen, etc. This picture shows the trend of snake bites during the seasons and during the months. It shows the maximum is during the months of June and July, where there is rainfall and temperature is moderate. This slide shows the different states: Asia and Africa, Middle East, Latin America, US, Canada, Europe, and the number of deaths and the envenomings happening each year these days. Now coming towards the recent updates. First is the article that a study of current knowledge base in training snakebite amongst doctors in the highest countries of India and Pakistan. Does snakebite training reflect local requirements? The objective of the study is to evaluate the current level of knowledge amongst doctors in India and Pakistan, two countries with the highest snakebite mortality in absolute terms. Results show that the use of current textbooks and medical education do not adequately prepare doctors to treat snakebite, particularly in the areas the use of antiseptic dealing with the adverse reaction and specific measures to deal with the neurotoxic bites. The central conclusion of the paper is that local protocols and trainings are required to adequately prepare doctors to improve treatment and reduce mortality. Another article is a study of 90 snake bite cases at Pakistan Air Force Hospital, Shorkot. This shows that a total of 90 cases of snake bite who reported in emergency department of the hospital were included in the study. There were 70% male, 30% female. The age range was 7 to 54 and the mean age was about 27 years. Most of the cases snake bite occurred between the months of April and September. 21 were the cases that brought the snakes with them. Among these, 4 snakes were scaled viper, 3 were kraits, and 2 were cobras, while 57% snakes left unidentified. Intravenomous anti-snake venom were given to 52 patients there, and it proved that early evacuation of the snake bite cases to nearest hospital that is capable of dealing with the snake bite can effectively reduce mortality and morbidity. Now, coming towards the MCQs. First is Ferdinand's boom snake and eastern tiger snake are poisonous snakes. These are life-threatening when they bite. However, a person has the business of selling snakes to zoo official. In which of the following situations venomous snakes are safe to handle for that person? First option A is when they are babies. Option B when they are asleep. Option C when they are dead. And option D is none of the above.
D.
Yes, option D is the right one because venomous snakes are never safe to handle because they inject venoms even after they are dead for about an hour or two. Second is Ali is a resident of Balakot, a highly mountainous area with lush green forest. He comes running to nearby OPD clinic with the complaint of snake bite half an hour ago. Only few medications are available at that clinic. If someone is bitten by a snake and doctor cannot get help right away, what the first aid should be given? Option A is keep the bite above the level of heart. Option B, clean the area with alcohol and water. Option C, cover the area with a clean dressing. Option D, aseptic dressing along with NSAID is given.
C.
Yes, C is the right answer. NSAIDs are never given in that patient. Third MCQ is Mr. Jones lives in North America where most snakes are not venomous, but those that are venomous include the rattlesnakes, etc. Approximately 20% of the population there has a history of snake bite. What can you do to lower your risk of being bitten by a snake? Option A is catch any snake you see on a hike and move them off the trail. Option B, kill any snake you see on the hike. Option C, wear thick leather boots. We're hiking through tall grasses. And option D, there is no any such measure to avoid a snake bite.
C.
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 Yes, B is the right one. C is the right one. Actually, B is not, because killing of the snake is also not safe to handle. Now, fourth MCQ is poisonous snakes voluntarily emits venom when they bite. Once the venom has been injected under the skin or into the muscle, it travels around the body through which of the following system? Option A, lymphatic system. Option B, arterial system. Option C, venous system. And option D, it is portosystemic system.
C.
A.
A is the right one. Lymphatic system is the first ever system that starts the venom to travel, and after that system, venom travels through arterial, venous, or any system. First system is the lymphatic system. Fifth MCQ is Mr. Asghar died in a village in Pakistan with a history of snake bite. An hour after he presented to Mayo Hospital, the friend gives history that the person is bitten by a big snake having short fangs on upper jaw, that is most likely cobra type. The death happens because of the failure of which of the following system? Option A, cardiovascular system. Option B, renal. Option B, respiratory system. Option C, renal system. And option D, neurological symptom.
D.
Neurological.
Yes, option D is the right one. Neurological system is the most affected by cobra type. Sixth MCQ is a person while doing farming presented to home with a complaint of reddish door leg. Swelling was also accompanied. He ignored it and slept after taking Brufen tablet. His wife made him wake in the next morning, but there was no sign of life in that person. Different snakes were found in his working area. Which of the following type of snake is painless but deadly? Option A is squirrel type, option B is viper type, option C copperhead type, and option D is the cobra type. Option A is the right one. Coral type is painless at first and is deadly. The patient couldn't feel the pain can happen, but after a few hours. But in this scenario, patient took painkiller and slept. That is why the whole time it remained painless. So option A is the right one. All others are painful. Seventh MCQ is the ultimate treatment for a snake bite is antivenom. It is necessary to ask about the history of allergy and intradermal sensitivity before inoculation. To further enhance the safety of antivenom, saline diluted antiserum, the test dose is given as follows. Option A is 0.2 ml at the exact site of bite. Option B, 0.2 ml at about 2 to 3 centimeters from the bite. Option C is 0.05 ml at the exact site of bite. And option D, 1 milliliter is given intravenously.
B. B.
Option B is the right one, because it is not given exactly at the site of bite, and 1 ml is not given intravenously because it is a big much amount. Option B is the right one. A few centimeter distance from the wound, the dose is given. Now, eighth MCQ is Aslam is a professional photographer. He claims that he has seen a venomous type of snake more than 5 meters in the forest of Nigeria. A variety of snakes can be of large size. However, some snakes can be as small as less than 1 foot. Which of the following is the longest venomous snake in the world? Option A is king cobra. Option B is black mamba. Option C is western taipan, and option D is the rattlesnake.
A.
Rattle.
Yes, option A is the right one. King cobra is the longest venomous snake, and western taipan, as seen in the option C, is the most deadly snake available in the world. Ninth MCQ is ABC is a fisherman by profession. He got bitten by a poisonous type of snake. After 2 days of treatment in the Mayo Hospital medical ward, his life was out of danger. However, debridement of the leg is required as the further procedure. His coagulation profile shows a PT of about 29 and APTT about 47. The appropriate step taken is option A, immediate debridement should be done. Option B, wait for the next 3 days. Option C, wait till coagulation profile is normal. And option D is partial debridement is the best solution.
C.
Option C is the right one. Wait should be done till the coagulation profile is normal. Immediate debridement is not done because it will lead to the bleeding loss and life of the patient will be at threat again. Now, 10th MCQ is a person XYZ was bitten by a venomous snake, was admitted in a tertiary care hospital. Antivenom was administered to reduce the effect of poison in that person. Antivenom was given intravenously. As a precaution. At least how much time should a physician advise that person to stay in the hospital? Option A is 12 hours, option B is 24 hours, option C 48 hours, and option D 72 hours.
B.
Yes, option B is the right one because 24 hours is the time that should be advised for at least stay in the hospital. Now, this is the key. These are my references and thank you.
Okay, thank you very much, Dr. Isma. Very nice presentation.